Well, it looks like there's a couple people that are going to be logging in a little bit later, so they won't catch the whole presentation, but I will let you know that the presentation is being recorded. So this will be available on the Diabetes Alliance of Idaho website, hopefully by the end of today, along with any potential handouts that I might have or different pieces of information that you guys come up with that you're interested in. So just to keep us on task with time, I'm going to go ahead and get started. And I just want to say welcome, everyone. I'm really excited that we're hosting our third Idaho National Diabetes Prevention Program networking opportunity. So these opportunities are all about, you and your programs here. We're here to share some resources and also to really just chat together about our successes, our challenges, and hopefully get some great brainstorming in and how to support each other along the way. So I really want this time to be informal. So please feel free to ask questions as we go along. And the easiest way is just to unmute yourself and ask those questions. And as people join throughout here, we'll just have some good interaction. So today we're going to be talking about recruitment and retention in the National Diabetes Prevention Program, how to use a session 0 for recruitment, what opportunities there are for advanced lifestyle coach training in this particular quarter. And then we're going to end with an opportunity to talk about what's happening locally with your programs. So we're going to start with a discussion on recruitment and retention in the National Diabetes Prevention Program. So we all understand the importance of recruiting eligible participants and then retaining those participants for the entire year-long program. And this is really vital to the sustainability of the program. So let's dive into this topic a little bit. There are several key parts to recruiting eligible participants, and here's just some important questions to ask along the way. Think about your target audience. Who is your target audience? Who are you recruiting? Eligible participants, right? We're looking for participants, that's who we're recruiting, but how do you reach them? Who is your marketing and messaging audience? How will you market your program? What's it going to cost to market your program? What avenues are you going to use to market your program? What is the message you're going to communicate? And how are you going to communicate that message? So the other component, what's a session 0? And why should you offer session 0? So we're going to dive into each of these key questions as we go along here. So who do you want to tell about your program? That's your target audience. Let's think about that for a moment. Local healthcare providers, we're connecting with them, we're promoting through them. Where are they found? Clinics, pharmacies. So where else would we find local healthcare providers? And I'm hoping to have some brainstorming along the way. And I know we're a little bit small in attendance today, so feel free to open up as I ask some of these questions. If you have ideas, I'd really love the brainstorming process that happens. We'll have time at the end of the presentation too to talk about some of these things in more detail. So hopefully as a few more people join us. So where do we find those local healthcare providers? How do we connect with them? That's something I want us to think about, and we'll do a little brainstorming here in a minute. Reaching the community directly. How do I reach my community? Am I going to use social media, the newspaper, radio? What are other ways that I can reach the community itself? Reaching community-based organizations, clubs, faith-based organizations. Connecting with community centers, senior centers, fitness centers. There's all kinds of ways we can reach out to the community-based organizations. And there's been some, I know, really interesting connections people have made with community-based organizations. And then what about reaching local employers? Are they willing to host maybe a class on their site? Will they encourage their employees to attend maybe an in-person National Diabetes Prevention Program or even a virtual one? So how am I going to reach them? How will I reach the local employers? And who will I reach? an important aspect of this is building relationships with these organizations, because that's really valuable for sustainability of your program. So I don't know, I'd love to hear from any of you about the most creative audience you've targeted. Can you think of any, or maybe you've heard of an organization? What would be a creative audience to target with your diabetes prevention program? Think about that.
Hi, Dorothy, this is Song. I can share something of an organization that did target an audience. And so the discussion was, I think they wanted to target folks that went to the gym, but a lot of times those folks, tend to be maybe a little bit more healthy than the general public. And so the focus shift to grocery stores and just being available there for screenings at the grocery store to target that audience.
Thank you for that, Song. That's a fantastic idea. I just love the creativity that a lot of the diabetes prevention programs have on, how to reach the community and how to recruit participants. That's one of the things that I think is really exciting about these networking opportunities, is to really kind of collaborate together and learn from each other. One of the reasons I've got session 0 coming up in a little bit that we're going to discuss is at the end of our last call, there was a great discussion about session 0s, what should be involved in session 0s, and programs were able to learn from each other on this. So that was really exciting. So that's grocery store is another great opportunity for outreach. Who doesn't go to the grocery store, right? That's great. Okay, if you'll pause for just one moment. I've got somebody trying to get on and they're having some technical difficulty, and I'd like to give them some help here. So just pause for just one moment and bear with. Thank you for that. We all know how it is when there's technical difficulties. We were talking earlier about gremlins in the computer as it is. So thanks for your patience on that. So yeah, think about these organizations, and we want to think about partnering with the organizations. When we partner with these organizations, some of them can really provide us access to resources, such as maybe some supplies that we need, volunteers to help with our programs, meeting spaces, different opportunities like that. So a couple questions to ask ourselves would be, who can you partner with for resources, right? Will maybe your local paper supply company be able to provide printing notebooks? Would they be able to provide maybe paper and binders, So where can you find volunteers? Maybe you can enlist volunteers from those community or faith-based organizations in your community. Does the local church or the senior center have space available to meet for classes? These are all resources that we need for our diabetes prevention programs, and really reaching out to our communities to bring them in to support us in this endeavor. So who have you partnered with in the past that has helped with resources? I'm just curious if there's any organizations you've partnered with, or if you've been able to find volunteer resources somewhere, or even just opportunities for organizations and businesses to donate to the diabetes prevention program. Any thoughts on that? again, we'll have some time at the end too to kind of brainstorm a little bit with some of these ideas. So going back to that relationships, to build relationships with healthcare professionals, we really want to begin by building a list of contacts, maybe contacts of our clinics, physician offices, hospitals in our area. But before you contact healthcare professionals to ask them to become involved, develop talking points about your program. Why is it needed in the community? And maybe some action steps that they can take to really partner with you. So, they can raise awareness among their patients through testing patients for prediabetes and recommending those who are at high risk for type 2 diabetes to enroll in your program. They might be able to assign somebody in their office to follow up with patients that they refer to encourage enrollment in your program. They can post information on your program in their offices, in waiting rooms, on their websites. They can post information on their waiting room, those TV monitors that everyone's glued to while they wait for a long time in a waiting room, or maybe posting an ad campaign about risks for type 2 diabetes. They can use that risk test. The AMA and ADA has put out a risk test for type 2 diabetes that can be posted maybe in waiting rooms, or they can use it, paper copies in their waiting rooms, or even posting it to those TV monitors. I've seen those in waiting rooms before where people can fill that out, or where they're on a monitor. So what other ways have you marketed your program through the local clinics? And welcome, I've got a few more of you on the line here. This is exciting. Hello. I know some people had some both technical difficulties and some time delays in getting in here. So we're really talking about how to build partnerships with healthcare professionals, clinics, physicians' offices, hospitals, all of those in our community to get involved in the diabetes prevention program or to help provide for that. So welcome all of you. So we talked a little bit already about who our target audience is, how to reach our audience, different ways we can do. And Song brought up a great suggestion that one of the programs was marketing at the grocery store. They were going to the grocery store and sharing about the diabetes prevention program. And I thought that was a great idea. We all eventually end up at the grocery store at some point. And so thinking about some creative ways to target some of our audience for enrolling participants in the National Diabetes Prevention Program. So we're kind of talking a little bit about some of the partnerships too. So as you have ideas, feel free to share those things. We're going to talk, so we talked a little bit about, resources that community and faith-based organizations might be able to share, such as maybe a meeting space for the program, help recruiting participants to the programs. Community leaders, especially those who advocate for community health, can really help spread the word about your program and, locate maybe some of those additional resources that are needed. Also, policymakers such as state legislators, the mayor, the city council members, any of those people in our communities, they can become champions for your program and bring attention to your efforts. So connecting with them, letting them even know what's happening in your community and what you're providing for them. Local employers, they might, again, allow you to promote the program at an employee health fair or provide incentives for eligible employees to participate in the program. Supermarkets, Song brought that up, supermarkets, local restaurants, fitness centers, retail stores, all of them might donate services and goods that can enhance your program. For example, maybe you can get a local sporting goods store that might provide a discount to your participants for physical activity supplies, such as those pedometers or different things like that. And then kind of thinking even broader, our government agencies and programs in our state and our communities can provide information and connect your program with partners maybe help you recruit participants. For example, we've got Song here from the Idaho Diabetes, Heart Disease, and Stroke Prevention Program. There's Indian Health Services, there's our local health departments, the Diabetes Alliance of Idaho. We're all valuable partners for spreading the word about your program and different ways that word can be spread. Some have newsletters, others have websites, or maybe even an email list of partners themselves that they can share when there's a new program starting, or different efforts like that. Media representatives, such as maybe your local newspaper. Maybe there's still magazines around somewhere producing things, radio, television, right? They can help you get the word out about your program and maybe publicize some of your successes with that. Physicians' offices, hospitals, community health centers, clinic staff, all of these can connect to maybe start testing patients for prediabetes, or maybe they're already doing that and then they don't know where to go from there. And so having your diabetes prevention program on their radar of some place that they can refer their patients who test in that prediabetes range, or maybe just find out that they're at risk by using that risk test that's available. So all of those are eligible participants for your program. So we're going to talk a little bit about marketing and what that messaging is. So the National Diabetes Prevention Program Customer Service Center has so many resources for us to use in marketing our program. And you can find talking points for that initial outreach. We were talking about having those good talking points. They've got them already outlined for you there. You don't have to reinvent the wheel and come up with different things. They've got talking points for that initial outreach to healthcare providers and organizations. They've got customizable materials that can promote your program. And if you haven't been to their website recently, you'll find it's been updated with a lot more marketing materials for different populations. In addition, they've got scripted, customizable radio, newspaper, social media, marketing materials, lots of materials that they've already been created and they can be customized for you. I believe it probably was the first presentation that we did, the networking event, I talked about the customer service center and some of the updates that they have. So if you haven't been there, go to the Diabetes Alliance of Idaho website and watch that first recording, and you'll get a good overview of how to use the customer service center. And then go to that customer service center and you can find a lot of the resources you're looking for. So just some examples of those materials that are available: brochures that can be printed, newspaper ads already written out where you can customize, posters, postcards, press releases, right? So opportunities just to get this out into the press, live announcer radio public service announcements. It's all scripted, sample articles, social media content, web banners, web content, testimonials from participants, these short videos that you can include in some of your campaign work. And then they have how-to guides to help you put all these materials to work. And then there's additional resources available in Spanish on the site too. So we're talking a little bit about retention. Okay, so recruiting. So before we move on to retention, what other ideas do you have for marketing your programs? What other ideas do you have for recruitment? Anything you've done in the past that can help other programs, or just questions?
This is Song speaking again, so I don't want to speak too much, but there was an organization that ended up sending out bulk postcards. So you can go to your local USPS and they can send that out to certain area codes or zip codes on your behalf. So that's always an opportunity that's available. I'm not sure about pricing, but you'll just have to kind of reach out to your local post office.
Right. Thank you. That's a fantastic idea. Yeah. Just how can we get this information into the community's hands? How can we get this out there?
Dorothy, I have something else I could add here, just as a suggestion to help kind of on social media for anyone in different communities. You might search that your community might have a calendar, like a local calendar for your community. and you can list your event there. And so if you're holding an event or a class or a program, you can actually like load your event in that area onto the community calendar. So that might be one avenue for you. And also the TV stations in some of the rural areas in Idaho, they also have a community calendar. So that might be an opportunity where people might be able to jump on there and load their event onto a community calendar, both in the newspaper and also or on a TV station.
Those are great ideas. Thank you so much, Katrina. Yeah. I mean, there's so much more available to us all the time, especially when it comes to social media and how things are just growing in that realm. So if any of the organizations that you're wanting to partner with, if they have a website, maybe being able to post things on their website, if they have social media, maybe being able to post, particularly as you have maybe new classes coming up, or you might have a session 0, which we're going to talk about in a little bit, and you want to really get that information out there into the public's hands so that they can attend one of those events. Yeah. Great ideas.
These are all awesome ideas. So thank you so much. I'm just kind of jotting down as fast as I can. I know we've already taken advantage of the NDPP, ads for both radio and newspaper and used those, and they've been really helpful. So I can definitely speak to that, although we're still struggling to recruit. So we'll try some of these other avenues. And we actually got our district to allow us to buy a couple boxes of A1C tests, and we were going to just go set dates to do free A1Cs for the community and just see who came in if they don't know if they have, either type 2 or pre, and see if that generates some interest.
That's exciting. And that's such valuable information for those, for the community. It's where am I? Do I have already type 2 diabetes? Well, let's get you some assistance there. Am I in that pre-diabetes range? Well, let's get in there and get preventative, with this. And so, and even those, the risk tests that are the little written risk tests, which is nice, where you can see if you don't have the actual blood work there, you can see if you're at risk. Because we know with the CDC recognized national diabetes prevention programs, there's a certain percentage that we can have in our classes that just qualify based on that risk test alone. They don't have to have the blood work. Maybe they're not there yet in that pre-diabetes range, and we can help them before they even get to that point. Yeah,
I'd like to hear more about that, because I don't think I knew that.
Yes. Okay. Yes, I don't have it on here, but I can certainly send you information. It's I think it was CDC and AMA put out this risk test, and it's been up for a few years, and it's basically talking about what your risk factors are in terms of age or certain risk factors or weight.
I know about the test. I guess I just didn't know that there's a percentage.
Oh, yes.
That's the piece I'd never heard before, because I use the risk test quite a bit, but.
Okay, so with your programs, 35% need to qualify by blood work in some way. This is part of the CDC recognition process for your programs. And then the other 65% can qualify just based on your risk test. So it's a certain minimum that we need with the blood testing, with the blood work.
No, I didn't know that.
Oh, I love when we all learn something new. It's great. Perfect. All right. Thanks for that. So we're going to kind of talk about retention here. How will you keep your participants coming back for an entire year, right? That's a big question. How are you going to help your participants overcome their challenges to attending? So some organizations provide incentives to help with that retention. They can be giveaways. It can be some financial assistance. Maybe it's a fitness center membership. So question for you and your programs, do you provide incentives? And what incentives do you provide? Or maybe what incentives would you like to provide if you could? Are any of the programs that you're aware of providing incentives to their participants?
I know we've been really cautious at PhD with doing that, just based on some of the grant dynamics or deliverables. But at the same point, we did just get an additional grant. And so we're gonna buy some like weights to give away.
Yeah.
And maybe some kitchen scales and things that just apply directly to utilizing those skills that they're developing. What we did get though, from that one website Song, I can't remember which website you told me about, but you know how it's got the little freebies, some of the things from that website. We got like measuring cups and measuring spoons and things like that, but we were really looking for something above and beyond that. And so with this other grant, we got it just a small amount of money, but we're going to get like pedometers and things like that as well.
And I think, Danielle, that's a good segue for me to put a plug in for that website. I'll drop that website into the chat for everybody, but the state does have some things that you can purchase or you can order for free off of the website. So if you go to the website that I dropped into the link, at the bottom of the page, you'll see order healthcare materials. Once you're on that healthcare materials, there's a ton of different things that you can order from that site. So there's brochures, posters, cards, and then in the other category is where we typically will put program support materials. So there's like cutting boards, measuring cups, water bottles, pill organizers. We're hoping to update some of this stuff in the next few months. And so just keep up to date on that site to see what we have coming up. But that's a free resource for everybody, anybody in Idaho.
Thank you for that. And again, I mean, it just goes to, partnering with organizations that can help provide resources or communicate all of that. And so, the Department of Health and Welfare, particularly with the heart disease, stroke prevention, diabetes, heart disease, stroke prevention department, just wonderful, wonderful resources and partnerships there. So thank you. I really appreciate that Song. Yeah. So thinking about, incentives, people talk about incentives, if giving these away, is this really going to help with retention? And I think some programs have found that it does. It might depend a little bit on how and when you provide those incentives. But who doesn't like getting something for free, right? Who doesn't like these fun incentives? When do you provide these incentives? That's another thing to think about. Are you providing them at the start of the program so that when people enroll, is this something that's attached to a particular attainment of a goal? Maybe it's attendance goals or weight loss goals. When do you provide these incentives? And is there any benefit to particular timing of providing these incentives? What do you think about that?
I think the timing's important. I don't have the most experience on this panel right now. Unfortunately, it was Troy and he's no longer with us. So I'm trying to pick up the pieces. And I think we had talked about getting incentives to get them through the core maintenance, part of it, and then launching into the next phase. So that's kind of where I'm thinking to provide them.
Mm-hmm. No, those are some great ideas. A typical time when you see participants tend to fall off is when you move from core maintenance from core to the maintenance. So you've got typically either 16 weekly sessions, then you go to monthly sessions, or a lot of programs though have altered that schedule to kind of mitigate some of those challenges. Maybe they'll do 10 weeks weekly, and then they'll do 4, 5, 6 months, twice a month, then they go to monthly, so that it makes it easier, that transition. But anytime you have transitions like that in attendance, you tend to see some drop out in attendance. And so maybe providing some incentives at that point where you're having these transitions can help with that transition time a little bit. Or if it's attached to attendance, I know there's one group that every time participants would attend, their name went into a jar. So every time they attended there, and it built up, and then they had some giveaways where they just drew names out of the jar. So the more attendance, the more potential opportunity you had to winning a giveaway or getting some of those incentives, which was kind of fun, or making some games out of it. Sometimes it was attached to questions. If people had questions that went into that jar to talk about, then it promoted some more that dialogue in the classes themselves. It all added up to some potential giveaway times. So different ways to do that, to kind of keep things exciting and moving throughout. So having to do with retention and having to do with recruitment, we're going to talk about session zeros. You might be familiar with what session zeros are, and you might not be familiar with it. So a session zero is an information session. Basically, it's used to recruit programs to your participants to your program. And so, what's included in that session zero? Well, that's really up to the program. What do you want to include? If you're providing information about your program, are you going to want to have your program goals, structures, maybe the commitment that's part of it? You're going to use a readiness assessment to determine the readiness of your participants, because this is a year-long program. So is this a good time for them to join this year-long program? And this is also a really good opportunity to collect that intake information that you're going to need for reporting. Right? With a CDC recognized program, there's reporting every 6 months. We'll talk a little bit about some of the things that are required on that and how this could be a really good opportunity to gather some of that information. If you're not familiar with the readiness assessments, there's a number of just simple readiness assessments out there that programs can use just to kind of gauge or help participants or potential participants gauge, is this really, am I ready? How excited I am for this change? I don't have to be 100% ready there, but if the participant is saying not ready at all, not interested at all, really don't want to be here on that readiness assessment, that could really prompt a good discussion with that participant to see if this is really an appropriate time to join, or to address maybe what are those challenges for that particular potential participant in joining. So these information sessions that are really valuable for communicating your program, for assessing readiness, maybe doing that enrollment intake there. How often should you offer session zeros? When would you offer these information sessions? Just before a class is going to start? How far before the class is going to start? I had heard of one group that offered a 30-minute info session every month to reach out to newly referred patients. So they were getting patients referred in on a regular basis, but they obviously weren't starting program or classes every month, but they wanted to connect with them. They wanted to share about the program. They wanted to get a little bit of a partnership already happening with them, and then plug them into the next available class that came along. So when would you start, or are you doing information sessions?
We did one prior to the cohort that's going right now for us. I think we did do it with the intent on starting the class the following month, but I really like the idea of just doing them more entitled info sessions to recruit, because that makes more sense to me. So that was great.
Yeah, I know when I worked at Gritman, we would do almost 2 months before our first class, we'd start doing a couple of them. When we first started marketing that class, we would market that information session. So when we were sending things out to healthcare providers in the community, we'd say, hey, come to this information session. And there was a couple of different ones available. Sometimes we could offer them virtual too. If we were doing a virtual program, we could do a virtual information session, right, to kind of recruit that demographic. But it was helpful to have them in advance. Part of what we were trying to do is assess when we should hold this class. So if we decided we're going to hold a class on Wednesday at 4 o'clock before we have the information sessions, and then everybody who comes to this information, none of them could attend Wednesday at 4 o'clock. Well, that's not really helpful. So we would come up with a couple of different times that would work for our program. And then in these information sessions, we'd say, these are the times we're proposing. Let us know. Absolutely cannot do this time. Boy, I could do either one of those times, so we could kind of narrow down and be able to provide our program to the majority of the people who were coming to that information session. So it helped us be able to kind of figure out when we were going to provide this, because that's something for programs to really consider. There's challenges that there's going to be challenges to people attending, and sometimes that's the time and day. So we want to be cognizant of that, and we want to be able to customize our program enough to where we can help overcome those challenges for those participants. So something to always think about when we're planning our programs. Yeah. So session zeros, we'll talk a little bit about that. What would you include in a session zero? So we know they're information sessions. Well, what are we going to do with them? What are we going to include in that? So there's just some things to really consider here on session zeros. Are you going to include maybe background on the diabetes epidemic and some of the results of the National Diabetes Prevention Program study? That'd be a good place to start with why we're even doing this. Talk about what's happening. Maybe you want to include the structure of your program, the schedule. Maybe you even want to hand, if you already know when you're going to do this, handing out a schedule to people. Do you guys hand out schedules in advance for the whole year? Plan out, here's your year. Here's the schedule.
We definitely schedule the whole year for our own knowledge, because just trying to work out how that's all going to pan out for staffing. But I don't believe we hand them out. We just have that expectation of we're going to meet the same time, same day each week moving forward. And if things come up, we will reschedule accordingly. Like often it's weather, right now during this time of year. But
Okay. It can be helpful for, and I've had a number of participants ask this, can I get the schedule for the whole year? Because I have vacations I'm going to be planning, and so they might think to plan around that schedule. We've had a few that were on vacation for 3 months at a time and they joined us virtually. They went to Hawaii for 3 months. Lovely. Wouldn't that be nice? And they could join the program virtually while they were there. So I think it really helps with everybody's planning with this, and it can help really overcome some of the challenges that participants have with the year-round schedule, with that. And if they know in advance that they're not going to be able to attend a class well in advance, that helps us as coaches to be able to schedule some makeup classes and kind of not be caught off guard with that. So I'm a scheduler anyway, so that just makes sense to me. I love having that available. And so I relate to those that do also. Yeah. So, okay, back to some of these things. The expectations, are you going to provide information on the expectations of the participants in regard to attendance and food and activity tracking? Some of those things, letting them know this is our expectation of you, and this is what you can expect from us as support, for you as you're making these lifestyle changes. But it's important for them to know that there will be some expectation of tracking on their part. Are you going to use this time to gather the required data for reporting? So there's a whole host of things that the CDC requires us to gather. And an enrollment form is a great place to have this. So you can get, obviously, the information that we need in terms of demographics. We're going to need their age for the CDC reporting. We're going to need their height. We're going to need their weight, those types of things. The weight's going to come in our first session that we weigh them in. But there's a lot of other things in terms of education level and different demographics that the CDC is collecting on this for that. And then also what I've seen happen before is if you want to connect to their provider and communicate to that provider, hey, we have a diabetes prevention program. Not everybody that comes into your program is going to be referred from a provider. So we would ask for them to give us the name of their provider and let them know by giving the name, they're giving us permission to reach out to the provider and let them know they're part of this program. That was just another way to connect maybe to one of the providers in the area that didn't know about, I didn't know my patient was in this program. So I can send them a letter telling them they're in this program. We want to tell you a little bit about it. And then I might send one on their progress through, or maybe one when they finish the program. Did your patient finish this program? Hurrah, and tell them a little bit more about the program. So again, more marketing that can happen in there, more connections with the providers in the area. So will you have past diabetes prevention program participants share about their experiences in the program? Or maybe you'll share other testimonials. That customer service site has a number of small little vignette of testimonials from participants that have been in the program nationwide. But having somebody who's just completed your program or maybe a year or two out come back and talk about their experience in the program can be really valuable to help connect and make it much more real and intimate in terms of the effect on their lives that this is going to have. So think about, what are you going to include in your session zeros? So I know there's not a lot of you out there who've done this. I know, Daniel, you've done some, and I imagine you've just checked off a host of these that you guys do in your session zeros with that. Have you had any past participants come back and talk? I always want to hear about that. Not yet. Okay. It's just a great opportunity if we can connect. Think about the personal connection that can really happen with at that level. There is on the Customer Service Center, there is this scripted set of slides that can be used to deliver a virtual session zero. This is available on that the National Diabetes Prevention Program Customer Service Center website. It's called Session Zero Guide for Live Video Conferencing. And so you can use this, you can use it as scripted, you can change it, but it just gives you a way to do this virtual one. If Bridget were on the call, she was on the call last time we talked about session zeros, and I know at U of I Extension, they do virtual session zeros. And so I didn't get a chance, she invited us all to attend one of her session zeros that they had upcoming. I had a conflict with it, I wasn't able to attend, so I wasn't able to see kind of how they do that and how it maybe is similar to one of these video conferencing session zeros. But this could give you ideas on how to do some of the virtual information sessions too. So before we kind of move on to talking about advanced lifestyle coach training, are there any questions, comments? We talked about recruitment, we've talked about retention, we've talked about session zeros.
Dorothy, this is Vicki.
Hi, Vicki.
So for the benefit of the group, I am the clinical coordinator for the Children's Idaho Diabetes Youth Program. So we're type 1, not involved with DPP, but you might be interested to know that even for us, we know that the numbers of children with type 1 diabetes are rising rapidly, or at least rising in a way in Idaho that we need to be aware of. And we are doing exactly the same sort of work for different reasons, how to recruit and involve children with and their families with type 1. So we're kind of listening with at least one ear to how things are going for you on DPP for a very different reason, with established diabetes and clients and families affected by that.
Thank you so much for sharing that, Vicki, and thank you so much for being with us. I really appreciate that, and we'd love to learn from you too, and you know how your programs are going, and really ways. I mean, we're all connected in different ways here to programs that reach out and connect to type 1 diabetes. So I'm sure there's other ways that we can support you too. Certainly the Diabetes Alliance of Idaho would love to reach out and support in ways, and there's a lot of public health districts represented in the DPP programs, or diabetes education programs that are represented in that. So ways that we can connect and support each other. So I'm so glad you're here. All right. We're going to talk just a few minutes about advanced lifestyle coach training. So I add this with each one of the sessions that we've talked about because different trainings come up and it's always a need. So the DPRP, the Diabetes Prevention Recognition Program, that's the recognition arm of the CDC for our diabetes prevention programs. And they started requiring in 2021 all lifestyle coaches to obtain 2 hours of advanced lifestyle coach training each year. So the training must be content specific to aiding that lifestyle coach with skills needed within that lifestyle change program. And it must be from a CDC approved training entity. So you can find the list of approved training entities on the National Diabetes Prevention Program Customer Service Center. I keep talking about it. There's just so many valuable resources there. So the 2 hours of training that needs to be obtained during your organizational program, it needs to be obtained on a yearly schedule. And so that means that you follow a yearly calendar based on your organizational start date, not the January through December date, not our typical yearly calendar in that way. So your year starts when your organization's first submitted data after the May 2021. So when the changes occurred, they occurred May 2021. So the next date after that your organization submitted data to the DPRP that's when you start your year. So for example, if your organization made a data submission in July of 2021, that's after that May date, your coaches will have until July of 2022 to complete the advanced coach training. So you just figure what month that your data submission occurred after that May 2021 date, and you go a year from that. So these are the approved training entities that can offer advanced lifestyle coach training. Some of them offer virtual trainings. Some of them offer virtual and live trainings. Some of them offer on-demand trainings. So there's just a lot of combinations here. So and I check these every quarter to see what's happening. And here's the list of what's happening this next quarter. There are currently 3 live trainings available this quarter. DTAC has a live training called Charge Up the Change. That's on Thursday, March 23rd. It's 2 hours, so it will complete the 2 hours of lifestyle coach training, costs $55 per person. Telegen has a live training called Coaching Presence on Wednesday, March 22nd, 1.5 hours, costs $110 per person. You'll see there's a variety of pricing here. And ADCS has a live training called Building Relationships. We'll keep them coming back. It's all about retention. That's actually scheduled for tomorrow, Wednesday, March 8th. This is a 1 hour and it costs $50 for ADCS members or $65 for non-members. So DTAC also has several on-demand sessions ranging from $40 to $55 depending on the length. This is not even all their sessions. This is the most current ones that they have. They have some fascinating topics. All Foods Can Fit has been a great topic with that. Food insecurity, habit formation, directly relating to the CDC curriculum, Liven Up Lifestyle Change, and the trouble with tracking, strategies with tracking. So all some fabulous information and connections for your coaches here. ADCS has several on-demand trainings. Their prices range from $30 for ADCS members to $55 for non-members. And again, their sessions range in length from 1 hour to 2 hours on a variety of topics. You can find these on the ADCS website, all the websites. I will have this PowerPoint on the Diabetes Alliance of Idaho website, so you can download the PowerPoint and connect to any of these links. State of Wellness has 2 on-demand sessions. Their prices range from $25 to $349 per person, but that's because their sessions range from 1 hour to 12 hours. So there's quite a bit there. J.M. Moss Foundation has some online, also on demand, and the Virginia Center for Diabetes Prevention and Education. Their website states that they're going to have some advanced lifestyle coach training coming up, but so far they haven't listed any topics or opened any registrations yet. So I'm looking forward to that coming up. Questions on advanced lifestyle coach training, opportunities, what that is, questions on anything that we've talked about.
Yeah, I have a question about the lifestyle training. I know both myself and the other dietitian employed here at Panhandle, we both went through the life coach certification in September last year. So it was a little confusing for me when you were saying according to submission, because I'm used to thinking, okay, according when we got certified, and then I'd go a year out, but it sounds like that's not the case. So could you cover that again, just so I understand the flow?
Absolutely, absolutely. Okay. The year that you get certified as a lifestyle coach, that's 12 credits. You're covered that first year. So let's say that your organization submits its data. Well, do you know when your organization data submission is? It's twice a year.
Yeah, we did it in January for the prior 6 months. So
okay.
I'm pretty sure, but I'll have to check.
Okay, so if you do January and June will be your submissions. So in May of 2021, you had a June submission in June of 2021. So your year is going to go from June to June. Okay. So within that year, so if you had your 12 hours of training within that June to June year, you're covered. And then you start the next June over with looking for 2 hours of advanced lifestyle coach training. And I will tell you, this is not something that you're submitting to DPRP. It's something they're asking you to keep on record. And they're asking you to keep on record for any potential audits. So it is something they can audit your organization and require at some point. At this point, they're just asking you to maintain that record. Yeah. Great question, though. Yeah, it's so confusing. I mean, you start looking at these, the dates of recognition, the dates of submission, and all these details, and it gets really confusing. Yeah, that's great. So good question on that. Yeah. So we have a few minutes left. I'd really like us to talk a little bit about our organizations, maybe what resources we need, what resources we can provide to others. What are our particular challenges in front of us right now? Are there challenges to sustainability, challenges? You were talking, Danielle, about just recruitment, getting the word out there. What challenges are you running into with that? And
so many. Well, I think really I am trying to promote sustainability of this program, and that we've had trainers turning over the last year that has made it just so difficult to have the recruitment efforts sustained themselves, even not being able to bring in really strong big groups. So I am struggling with, how do we sustain this program right now? How are we going to bring in and promote more cohorts when we're now limited staff? And how are we going to pull that off? I don't know. And so I'm just kind of trying to figure out what all the possibilities are, and how to build that up, because I know the need's here. I know it's here, and there's no other DPP program up here.
yeah.
At least not in these 5 counties. And I don't know how to get the word out. I've been meeting with providers. I've been sending our marketing materials and pre-diabetes tests everywhere. I think I'm gonna, like I said, start the freeway A1C for people that, show a risk positive on that test, for maybe even grocery stores or even, appointments at our PhD offices to say open season, and the newspapers come in and see if you have it or if you're at risk. But it's a struggle, and I know I'm rambling. I'm just coming cold, so I have a lot of Dayquil on board.
Yay for Dayquil. Keep them going.
So that's where we're at.
No, those, and the things that you talk about, those are common challenges. You're not alone. I'd say a couple things just to keep in mind. We get these seasons of turnover. We get these seasons of just sort of the perfect storm of things happening. If you can focus on keeping your program recognized, what do I need to do just to keep going while I'm building in the background over here, right? So keep that program recognized. You've got to have a minimum of 5 participants complete your program every year. So, you got to work on keeping those 5 minimum. So obviously that's when we want to have a class of 10, because we know the potential dropout rate and things like that. So if we can just keep ourselves recognized, and then keep in the background, how am I going to keep this built up? What am I going to be doing? You've got some great ideas on that A1C testing. I would encourage you to get out to the community. Much harder to get people to come into you, right? Much easier if we can get out to the community. Are there any health fairs coming up? It's starting to be maybe spring. I don't know. I keep hoping in our area. Spring comes so late, but oftentimes March and April and May are times when health fairs are starting to come back out. And I think they're starting to come back again. So some of these in person, is there a health fair I can get to? I love the idea of getting out to the grocery store or getting out to some point of contact where you've got the public, and we can do a point of a testing point right now, and you can find out, what's your A1C. Let me tell you what an A1C means, and what this means for you. And we can talk about the rate of diabetes in our communities and pre-diabetes and what there, and there's solutions, there's options, right? It's not a death sentence. This is what we can do about it. So presenting that really positive message can be really encouraging for people, I think. But getting out to them is something I would really encourage you with. What about you guys, ideas on that? I know, Vicki, you're talking about kind of doing the same thing, in your communities and getting out to the public. Are you finding potential places where it's really viable for that?
We're doing a lot of places where Lisa is just a genius at this, our executive director, at bringing together 2 really unlikely groups. So we have people that might be getting together for something like, I don't want to use any bad examples, but she is working very closely with the Lions. So if the Lions are working on something for their fishing derby or something like that, then our camp programs will turn up as, and here's a group that they're wanting to help. The best example I can think of, and or not example, but idea I would have as far as our programs with kids camps, is that when adults with type 2 come into the face of the children with type 1 who are testing and taking shots and counting their carbs and then blasting off back out to do their activities, a lot of times we do see the faces of those adults say, wow, gosh, if this little 6-year-old can do it, I guess I can. So there's some neat things possible there. It's why we hang around, even though type 1s often spend a lot of time saying, you know what, we're not type 2. And yet some of that burden is so familiar. But I don't know, yeah, having our population be both an example, but then also we need the help of people like the type 2s to just help us pull off our programs.
Absolutely. Absolutely. And to communicate, about the programs to the community, and anybody who has resources. I know that the Diabetes Alliance of Idaho has been able to promote through our newsletter, but other opportunities to promote what's happening in the type 1 community, especially those camps. It's life-changing when you even visit for a few hours. I was able to visit for a few hours one of the camps up here in northern Idaho, Camp Styx, and it just like you said, they're doing their testing, they're doing the carb cutting, and they're running back out doing exactly what they want to do and conquering the world, in the process with that. And it's life-changing to see that. So I love that connection between the two organizations and between the two populations. And I really like what you talked about, just kind of tagging on to some of these other organizations. What's happening? Can we go to our Chamber of Commerce website and see what events are happening there that maybe we can add one of these testing centers to, or testing opportunities to, or like Katrina was talking about, some of these calendars. Can we find out what's happening in our community and be able to connect and coordinate together with other organizations? There's a lot happening, and I think there's a lot more happening now coming up with this spring, and a little bit more in-person opportunities that are going on. So yeah, I would just encourage to reach out to that and let us know how things go. And as we think of ideas, I can certainly be that focal point for people. As you have ideas, send them to me, and I'm happy to share them with the group. We can kind of keep this networking wheel going. So I really appreciate you guys coming and sharing this. And again, this is being recorded for those who are not able to attend. So hopefully that's going to spark some more discussion. The discussion could be through an email with me, and I'm going to share it all with all of you. So any final questions or thoughts or suggestions?
Oh, I was just asking where Danielle is.
Oh, I'm up in Hayden in Coeur d'Alene area.
Gotcha.
Yeah. Good to meet you, Vicki.
Too.
Yeah. Great. Well, thank you all again for being here, for being willing to share, and being willing to encourage one another. And I look forward to, we'll have one more scheduled in, I'm going to grab that date really quick because for some reason it's not on the top of my mind. It's May 10th. It's a Wednesday. So one of the topics we are going to talk about are umbrella hub organizations. So that'll be something I'm really excited to. We began that discussion a year or so ago with the diabetes prevention programs in a survey that I provided, and so I'm excited to share some next steps with everybody. So I hope to see you all there, and I really appreciate your time today. You guys all have a great afternoon.
Thank you.
Thank you.
I was trying to figure out how to unmute myself. Can you hear me?
I can. I think Vicky, that might be Vicky's phone that's still attached. I think she was
Did
started by phone.
Did you want to log out and log back in underneath that other link, or should we just hang on here?
I was just thinking we could just hang on here.
Yeah, that's great. It
I
just
was-
shows
oh.
3 participants here, so.
Let me remove the iPhone. Okay, I was just able to remove her. I think she just still had her phone attached. She was trying to log in a couple different ways. So yeah. Oh, let me stop recording. That might help. Oh, maybe it does stop record. Oh, there it is. I'm thankful that